Welcome back to Connect MKE. I'm your host, Andrea Williams. Our focus today has been on systemic racism. It's described as racism that is pervasively and deeply embedded into systems and structures such as laws, written or unwritten policies, and widespread, deeply rooted established practices and beliefs that produce, condone, and perpetuate widespread unfair treatment. Froedtert and the Medical College of Wisconsin has a mission to advance the health of the people of the diverse communities they serve through exceptional care enhanced by innovation and discovery. Joining us is Andres Gonzalez, Vice President and Chief Diversity Officer at Froedtert and the Medical College of Wisconsin. How are you, Andreas?
I'm doing well. Thank you for having me here.
I'm happy to have you join us today. Now, you provide direction to the Office of Diversity and Inclusion, where you lead strategic initiatives that work to eradicate racism. So if you would talk about your top priorities in doing that.
Sure. So I will start by saying and acknowledging that at Froedtert and the Medical College of Wisconsin, we understand that many of the communities that we serve have been touched and impacted by racism, number one. And by doing so, we have been very thoughtful and strategic on creating a strategic plan now that we have titled Eradicating Racism and Enhancing Health Equity. Under that particular plan, there's a set of strategies that we've created, but I think I would like to highlight one particular thing that I think stands out to me. And that is, we decided and deliberated long and hard and came up with a anti-racism pledge that we stand for. And it was not only about flowery words and calling racism a health crisis in America, and certainly right here in the greater Milwaukee area or in our state, but as importantly, having some key actions that we're willing to undertake. Number one, it's about treating people with dignity and respect. Number two, it's about examining our own biases. Number three, it's about reviewing, tracking, and measuring all of our policies and our practices to ensure that everyone will have a fair and just process and practice moving forward. And number four, it's about leading change in our community by addressing our health disparities. So I think that really speaks to that work. And then furthermore, we have now have those posters in every single facility. So we are inviting our community to learn more about our plan, our strategies, and so our plan now lives on our external website. So we want to make sure that we're transparent and accountable to that work.
Yeah, I love that. And so amongst the things that you've just talked about, you've got community engagement and also talent acquisition. All of these things are falling under that umbrella, and just being aware and doing a better job of making sure there is diversity and equity across the board.
Absolutely. Yeah, so I touch on maybe a little bit more in terms of patients or the patient-facing side or community side, but you're absolutely right. I mean, we're an employer of choice or workplace of choice, as we like to say, and so for us, it's critically important to ensure that all of our staff also have that inclusive and equitable, practice and opportunities within our health network.
Yeah, so as we've already established, we know that racism permeates every aspect of society, healthcare included, and combating systemic racism in healthcare pretty much starts with understanding the many forms of racial discrimination and determining what changes can be made to make healthcare inclusive and equitable. You've just touched upon some very important things that you've done and that you plan to continue doing to make a difference. So I'd like to get a few examples of what you're doing internally to address racism and unconscious bias, because you guys have what you call the business resource groups and diversity action teams that help foster inclusive culture. So please talk a little bit about that.
That's right. So I'll start with one of the first things that we built on our plan is educating our own staff, right? Ultimately, we want to make sure that everyone understands and have some line of sight on how they can actually live up to our mission and really provide both culturally and linguistically equitable care at the end of the day. So one of the things that we're doing is we rolled out unconscious bias education as well as anti-racism education. And I think the uniqueness of what we're doing is not only providing an education, but also providing our leaders, our staff, an immersion experience, for them to really experience that firsthand and really understand, and sometimes maybe put themselves in someone else's shoes to gain that appreciation for what some of our either staff or community members have experienced right along the way. So that's one of the first things that we have built, that we have rolled out. But to your point as well, we have our business resource groups and the diversity action teams, and they are an extension of our team. So they actually work on creating greater staff engagement. They actually help us to think through our strategies, from recruitment to retention to developing our staff, to also providing insights about our patient and consumer needs that exist. And I think that in the last 2 years, for sure, BRGs were paramount on helping us to really understand what has been the impact of COVID in diverse communities. Right. And what is it that we can do differently and better, right? And live up to our mission and our commitment here of eradicating racism and enhancing health equity. And so it's been wonderful.
Yeah, I was just going to bring up, like, how much of a role did the pandemic play in really realizing that there are so many disparities that exist? And I think healthcare and the healthcare industry has been aware of those disparities because you deal with it every day. But I think that the pandemic really did shine a light on how much of a difference it was making in the lives of everyday people.
Absolutely. No, you're absolutely right. I mean, I tell everyone these days that the pandemic, if anything, was an affirmation of what we already knew, right? And even for those that were sweeping that under the rug, bottom line is you can no longer do that, right? I mean, it's what I call a quadruple crisis. Not only it actually exposed the realities in terms of the inequities or the healthcare disparities that exist, it also uncovers some of the economic impact in our diverse communities. It also uncovers some of the social or community unrest that we saw, right? I mean, in George Floyd, I think there's, now terminology using about pre-George Floyd, post-George Floyd, but I think we can make the argument that our watershed moment here happened in 2016 that led to the 3-day unrest in the community that now we know as the Sherman Park unrest. And so I think for many of our communities, and certainly for us here, we have been dealing with this for a number of years. And I think for Froedtert and the Medical College of Wisconsin, we decided that we were not going to stand on the sidelines, that we're going to be proactive around addressing these issues head on, but also not doing it by ourselves, including our staff in that process, hence why the BRGs are such a great vehicle and partners in those efforts, but also engaging community authentically and transparently. And I think that that has been part of what I call a secret sauce in getting it right.
A secret sauce, I like that. Froedtert was one of the first to sign the Metropolitan Milwaukee Association of Commerce Region of Choice Pledge. And your CEO, Kathy Jacobson, she serves as the chair of the MMAC board, and she has said, quote, "At its core, our job is to care for people, and in this work, we are often treating people affected by symptoms caused by racism, trauma, and violence," end quote. So talk a little bit about, those particular things, the trauma, the racism, the violence. How have you taken steps in order to specifically hone in on those things?
Absolutely. Well, those are realities that are happening, unfortunately, not only in the greater Milwaukee area, but in any metropolitan area, right? I mean, I think we're not immune to those realities. I think, again, what we have done is to be proactive, to make sure that we're educating our staff so they understand how to treat with dignity and respect every single patient, not some, but all of our patients that are coming through the doors. Number two, that we're engaging our community authentically. One of the things that we have done differently and better now is that we have these community conversations. And we're coming in with a lot of humility into the community, seeking to understand where the community is at, but also realizing that our community has a lot of strengths and they have a lot of resiliency. So it's not coming with a deficit perspective or mindset, but one of acknowledging that, there's some things, that are going on, but you've been resilient. There are things that are working. Help us, right? Educate us so we can understand better what's truly the pulse of our community, and then we're inviting them to have a seat at the table and co-creating with us the right solutions. And I think that that has been also a big, big difference for us in terms of getting it right and really building now solutions that, whether it's actually on the staff-facing side or on the patient or community-facing side, people are saying, yes, you got it right, Froedtert and the Medical College of Wisconsin. That's truly what we needed. Because sometimes it's about just showing up to be active listeners and really seeking to understand what is going on and really having a better perspective.
Absolutely. And as we wrap up, is there anything in particular that you wanted to make sure our viewers knew about in the work that you're doing?
Yeah, will be remiss if I did not mention the Reverend Dr. Martin Luther King. It's someone who I hold dearly in a pedestal, and I think because of the great work that he did, obviously he paved the way for many of us. Mm-hmm. But something that actually we have used as our North Star there is really understanding, and actually there's a powerful quote that he shared in 1966 in one of his, certainly speeches, and it actually says that of all the forms of inequality, health disparities is the most shocking and inhumane. And I think for us, that has become our North Star. Okay. We know that there's actually, we've come a long way, we've made great strides, but we also know that there's actually a road ahead. We know there's actually greater things that we can do, not by ourselves, but again, empowering our staff, involving our staff in that process, but also involving community. And I think that that's truly how we're going to live up to our eradicating racism and enhancing health equity.
Well, I thank you so much for coming by and sharing all of that great news. I think it's great news, and it leads us to a better tomorrow for everyone living here in the Milwaukee area. So thank you for all that you do, and thanks for stopping by today.
Thank you for having me. Appreciate it.
It has been a pleasure.
Thanks.
Andres Gonzalez is the Vice President and Chief Diversity Officer at Froedtert and the Medical College of Wisconsin. For more information on anything we've discussed today, you can visit their website at froedtert.com/end-racism. That's going to wrap up this edition of Connect MKE. I'm your host, Andrea Williams. As always, I thank you for watching, and I hope you join us again next week as we connect you to the issues and the people making a difference where we live, work, and play. Have a great day.